Well, a pleasant good morning and welcome to the CCG Hour. It is great that you can be with us this morning, that I can be in your homes. Thank you for having me and my good friend Ann Hopkin with us this morning. Ann, good morning. It's good to have you.
Good morning. It's a pleasure. It's really a pleasure.
Yes, it's long overdue, at least what we are going to be talking about this morning. And the truth is, I just want to hit right into the program. You know, normally I interfere with you a lot. And
yes. We have a lot of important things to speak about.
Correct.
Yes.
And for those who have been, keeping up with us, if you had kept up with us for, I think it was a little while back, we looked, of course, we started off, for those of you who don't know Anne very well, we started off in this program dealing with... It was kidneys, yes, because Anne is the president of the Grenada, the treasurer of the Grenada Patient Kidney Foundation. So that is how our relationship began. And we said, hey, you know what, we deal with kidneys. And well, wonderful, we dealt with kidneys. And then we realized, we have so many other body parts to deal with. I think we could call it that, just body parts.
The body parts, yes. You know, and a lot of education to be done, a lot of knowledge to spread. So we therefore said, let's do other programs.
Correct. And we are here, and so for those of you who follow, we're usually here with Anne every third Friday of the month, which is just great. So, as I said, this morning, I can't afford to have much ado because we really have to deal with this. We hinted that we would have done it some time ago, but we really need to get to it because it is a topic that it's so common, yet it is so not well known. At least the information that surrounds it, everybody speaks about it. So we'll be talking about menstruation this morning, your period. They think, well, for ladies, of course, but we really do hope that it would not just be ladies alone looking at this program. I really believe the men should be really involved because men, you are fathers, you are wives, and you have ladies around you, and you can't help but have to deal with menstruation. And the thing is, most people, that's it. Some people don't even know the name menstruation. They just,
I'm having my period, I'm bleeding, I'm flowering. You know, the thing is on me, you know.
Crossing the Red Sea, all kinds of names.
All kinds of names, yes.
Right.
Yes. But I think because people is ashamed.
You find still?
Before, there was, you know, they go to work and, oh, she's bleeding, or, you know, so this becomes so a private thing because it comes from a private part. So you think it's something so private. You know, our mothers will tell the children, no, you're bleeding, you're having a period, don't kiss a man and don't hold a man's hand. Instead of telling them.
But I think they didn't know because then definitely we have to go into the history a little bit, especially our Grenadian history, our Grenada history of it, how people really dealt with that before. I really believe, because when I was seeing my period for the first time, well, of course, children, you hear a lot about, you talk a lot in school, but all mommy said was, well, don't go around no boys. Okay then, well, that was a slight problem for me because all my friends were boys. So it's like, okay, how do I not go around them? Plus, I'm going to Heinzie school. That's boys and girls. So the concept of don't go around them, it didn't really click until I knew what that meant. It didn't make any sense. I won't lie. For a small child, it didn't make much sense.
I mean, 85 years ago, say 80 years ago, say 70-something years ago. I mean, people having the period, it's not a daunting because we use cloth. Right? Now we have tampons, we have things. We use cloth and your mother washes it because she wants to know if you are pregnant or not.
Really? Okay, hold on. Well, I didn't know about that part. They had to wash it for you?
They washes it.
Joking.
Because they wants to know whether you have your period or not. And I know most people, the children get pregnant and they will get some blood somewhere and fake the mother and think they have in the period.
Stop that.
Of course.
A lot.
Of course.
Hold on. Okay, let's not go too fast. Let's back up. All right. Wait. So, I mean, I really want to go into, the organs and so forth, but hold on. So, let me just take it slower. So, in your time,
yes,
as a young lady,
yes,
parents would wash the daughter's sanitary cloth.
That's right.
It used to be diaper and things
diapers, yes.
Right.
Cloth, yes.
And the main reason is?
They want to know if you are pregnant.
Okay.
So they want to know if you missed your period.
So what about the people who would have had some kind of natural issue? Because, I mean, that happens. A lot of girls, women, miss their period, not because they're pregnant or anything. It's just that they don't have a regular, they don't have that kind of...
And they wait and see, and then they take you to the doctor.
Okay, all right.
Yes.
No beating taking place at that point.
No beating taking place at that time.
Okay.
Until they find that you are pregnant. Then you get a beating. Then you shame me. You shame me.
Mm-hmm. So that beating was certain.
Certain.
Okay.
Depends on the parents.
Okay.
Depend. Because even in my time there was patient parents don't care that much.
Right, right.
So it depends.
Okay. All right. Okay. Yes. So right now I think there was a little bit of research I was doing. Just before COVID started, I can't remember, oh my goodness, the name of the place. How did that just leave me there? But there is a place where they're doing a lot of education on period, because you know that there is this thing about period poverty these days and all of that.
Yes.
But where they're giving out sanitary napkin, but it is they've made it in such a way, so what we call a piece of cloth, they actually made it to be able to be washed. So, and they're giving that out, because a very poor country, how could the name just elude me there?
Yes.
But anyway, if I remember throughout the program, at least the next time, because I know we won't be done today. But that is really interesting, that they're doing that. So I'm raising that because I believe a lot of people still are thinking like, oh, something is wrong if I use cloth still. But the truth is that it is more economic, it is more environmentally friendly and more economical, for real. And nobody knows what's going on with you there anyway.
Okay.
But I really do believe that, because for tampons and of course then of course sanitary napkin, you still have the plastic.
They still have the plastic there and things like that.
So a lot of people might think who put it on cloth, but really and truly cloth nothing is wrong with wearing cloth.
With it. They use it for years and many years, and nothing is wrong with it.
Okay, what are some of the other things they used before? I know there must have been some interesting things, but I doubt we even had
backs.
Okay.
They used tree backs.
How did that keep the blood though?
They put it between paper and they push it out. In France, in 17th century, 18th century.
Wait. Okay.
Yes, they use the tree backs, right? And they pong the tree backs.
Oh, you pong the tree backs?
Yes.
So it turned into what, like a...
Soft, pulpy. Soft.
Oh, okay.
And it become absorbent. You know that maybe there were special trees.
Okay.
That, because now you have soft trees.
Yes.
You have hard trees. So maybe they know what special tree
that they had to
use. That they have to use. But somewhere in the 19th century, people start to figure out your period and a woman constant bleeding and what's the best thing to do. What's the best thing to do? So in the 1890s to the 900, the first sanitary belt, which were called hosier sanitary belt, was established.
A sanitary
belt. You put the pad and you belt it around.
Oh, because I suppose, they don't have any adhesive like we have on the pad.
So you put it, they have 2 strings. 1 string in front, 1 string in back, and you put a belt to hold it up. Right? Look at it.
Hold on,
wait. 2 strings, right?
Yes.
1 in each end. Right?
So 1 on each end of the pad.
Yes.
Right.
So you put it this way, from back to front, and you put a belt around your waist.
To hold the string. And then you tie the string.
Yes. To hold the pad. And you tie the string so the pad don't fall.
Right.
It stays stable.
Okay.
You get it?
Yes, I get it. I have to kind of condition my mind.
yes. So, like the mask, right? Where's the mask? Don't you mask up 2 heads?
Yeah.
Yes.
Okay.
So you put this below.
So
so
right. So this is a person here.
Yeah.
So this is you here. This is the front. This is the back.
And you put a string to hold it.
And then the string goes around your waist to hold it.
In the hole.
Ah.
Yes, to hold it.
Okay.
Yes.
All right. Okay, then thank you for that. That's interesting. I'm really glad that we don't have to do that right now, because it sounds like a lot of work. Because if you have to go changing this thing,
yes,
whenever, it seems like you have to be
just
all
untie the
naked.
string.
Yeah, but okay.
It comes out, you know, you invented all things for the moment.
Yeah.
To use at the moment.
All right.
Okay, and then we had Johnson & Johnson in 1929. The first tampon was invented by Dr. Earl Haas, Haas. So the first tampon was in 1929.
Right.
Right.
What was that made of?
Regular wool.
Okay.
Wool.
All right.
It's absorbent.
Right. Okay.
Okay.
Okay. So then we start to get,
Yes.
it begins to get what we call normal.
Yes.
All
and
right.
they start to figure out women in war. Nurses in war.
Right.
War,
Right.
They have to do something for them.
Okay. Okay. They can't go around with all this.
Right. They have to develop some things. Yes. You know, the history of menstruation is really strange. Over the centuries, society attitude to woman has altered.
Right.
Because when you having your period, in some countries you are tabooed. You cannot, I know in many African countries, a woman who having the period cannot go in the kitchen.
Right. Okay.
Yes. They said that you cannot make jelly. It wouldn't, you know, you cannot go in the cemetery.
What will happen then?
You understand? No explanation. Okay. You can't go in the cemetery. You can't pick flowers because you will spoil the flowers.
No, that one I've heard. You can't go to the, you know, oh, don't pick no flower. And I remember growing up and it's like, okay, this is not making sense. So you know for sure. And I was extremely curious all the time. So I would deliberately go when they're not looking and pick everything that they say you shouldn't pick while I have my period. Just to see. Yeah, but hello, not a thing happened.
Not a thing happened. Okay, not a thing happened. You shouldn't need bread because the bread is not going to rise.
Oh, stop it. That's ridiculous.
You know, before you press your hair with comb, you shouldn't do that because it will turn quickly. It's not going to last.
From the period?
Well, that's myth. Okay. That's just myth. That's not really concrete.
At all.
It's just myth.
Right.
Oh. You know, don't bathe. Don't bathe. You can't bathe. You just have to have a little wash up, but you can't bathe. And this is the time you need to bathe.
Okay, well, I've never heard that one because you don't bathe.
The older people like me will know that you don't go in the water, you don't bathe.
You mean in the sea? Or don't bathe?
You don't bathe, period. You wash up, but you don't bathe.
Okay.
Because your pores are open, because you're bleeding, and your pores are open and you're going to catch cold.
Oh, Lord. All right. It's good that we are in the era that we are in. Yeah, definitely, because
I'm part lucky then.
I know for the beach. I know they used to say don't go to the beach.
Yes.
I don't know what would have happened if shark might have take you or something.
The blood maybe comes out and the shark and the fish, but it's not true. Like in Africa.
Because I mean, how much bleeding can you bleed for shark to come behind you?
And South Africa, they cannot go to the river because
you dirty the water.
They dirty the water and they pollute the water, and the gods are not going to favorable to them for crops.
Oh my. Oof. All right. That's a lot. Well, we really thank God for knowledge.
Very thankful for knowledge.
Yeah. No, for real.
Knowledge increases as we go. Knowledge increases. Yeah. And we have to use the knowledge as it increases.
Yeah. No, definitely. But there are still people who seriously don't know, even right now, a whole lot about their period.
A lot of people.
Right. Okay.
A lot. Okay.
So,
what is menstruation? Really?
Right. I was just going to say, so tell me, so good. You went in front of me.
Menstruation, a period, is a normal vaginal bleeding that occurs as part of the woman's monthly cycle. It's a normal, natural phenomena in a woman's life.
Right.
As she grows older, every month your body prepares for pregnancy. If no pregnancy occurs, the uterus or womb shed its lining. The menstrual flow is partly blood, partly tissue from inside of the uterus. So it's not blood alone. It's the tissue, the lining, the endometrium, is the lining of the uterus which sheds during menstruation. Okay,
so we'll pull up a picture of that in a little bit. But hold on, just before we go, when you say tissue, Is that the same as what people would normally, some women would say, oh my God, I have a lot of clot blood coming, you know,
that
when I'm
mixed with tissue, the lining, yes.
It's really some of
the
that.
lining of the tissue.
All right, cool.
The lining, yes.
So I would like us, we have some pictures, of course, to help us, but just before we go into that one, I personally have a question, and I know that I asked you if we can please use this picture, the external part first, before we even go inside of menstruation, because I believe for some people, I know for sure that when I taught at school, at least you taught children the different parts of, you know, from their reproductive system. I really believe that for some people, even adults, there might be a little bit of a challenge in terms of what's really going on there, because I don't know if for some people, other than the doctor, if they really look at their vagina, well, their reproductive organ. I mean, because that is the thing. Everybody calls the whole, what you can see, your vagina. So I have this. If we can, you know, view it, really look at the various parts of it. I'll be really grateful.
This is a picture of your vagina. Look the two buttocks here, okay? And look your anus here. Your anus is, how do you call it? Your anus is where the feces come from.
Right.
That's your rectum.
So that is the end of your digestive system.
That's the end of your digestive system. You have the clitoris here. You see all this here. That's you call that the pubic hair.
Right.
The pubic, because that's the pubic area. You have the clitoris here. That's where you get your pleasure from. Right. Your clitoris. Then you have to look at your mouth.
Hold on, wait 1 minute. Don't go too fast. So the clitoris, because it's not just us telling them, but people being able, if they were to, if you were to sit in front of a mirror with your legs apart, and put a mirror in front, you know, and have a look at it. I want people to make sure that so your clitoris is that little, it's just the little pointed area. Right.
That's right. Look at your mouth. Your clitoris is your tongue. Your tongue in your mouth.
Like the tip of your tongue.
Is like your clitoris, because your mouth is like your vagina. You have upper lips, lower lips, and a tongue, just as an opening.
I'd never thought of that, but okay then. Huh, all right. Continue.
You have two lips, the lower lips and the upper lips. Look at it. But those lips are side by side. So you have the inside lip, which is very thin. Okay, it is called the labium minora. Okay, and the thick one outside that protects and closes the vagina. Closes it. That's for protection, so infection don't get in there. Your labia minora.
Right. And so when you when a woman stands, what we see as just this.
Slit.
Yes, just slit.
Yes.
Right. That is your labia. Close there to protect.
That's right.
To cover the whole.
That's right.
All right.
And you have your vagina here. That's this hole here. And this is a lot of soft tissues. So when you are giving birth, it can expand so the baby can be born. And this is your hymen here. If you never have sex, your hymen is intact. This is where you say, I lost my virginity. This is your hymen. It's called the hymen. So when the first time you have sex, this hymen is broken. And then,
so hold on. So if a virgin is sitting like this, you will be able to see the hymen. You actually seen it, or you can't really see it? Okay, you can't really see it. Okay, just making sure. You left out one hole.
Oh, the urethra, that's where your urine comes from. This one is your urine here.
So that's the first little hole.
Little hole.
Right.
So when you put in a catheter in someone, you locate the clitoris, and then you locate the urethra, because it's right under the clitoris. So you don't make any mistake, because you don't want to push the catheter in the clitoris. Because sometimes people have small clitoris, sometimes they have a large clitoris, and you mistaken it for the urethra.
Okay, how do you
because sometimes people have very large clitoris, and you cannot cannot distinguish. And that happens sometimes. You push it in there itself.
Okay, so, and that catheter is, that is what we're talking about when we're dealing with this, with your kidneys and so forth. That is why you
pass urine, and they want to catheterize you to get a fresh urine to be tested.
Okay, that is where that will be pushed
so
in.
this is the view: your clitoris, your urethra, your two lips, your hymen is here before sex, and then your anus where you pass feces.
Right. Whew, all right, that's great. All right, so let's go. Now we could go to the what you were mentioning with the menstruation itself.
Menstruation itself. This is a picture of the organs that are involved in menstruation are the fallopian tubes, the uterus, the ovaries, the vagina, and the cervix. The cervix is the hole here between your uterus and your vagina. Look at your vagina here. So
of course your vagina, and I'm making this very clear, for many people who I believe still may not be aware or may, maybe a little confused, your vagina is really up inside of you.
Yes, it's you see right
here.
Yeah. Right there.
So that's the opening of the vagina actually
that's the opening of the vagina there.
Right.
Yes, but everything is outside and the clitoris is there. Okay. So if you have sex or you don't have sex and do not get pregnant, you have the ovaries, which have the eggs. And only one ovary ovulates. What I mean ovulates, the egg become ripe and the eggs come out from the ovaries. And when the eggs came out from the ovaries, it gets here, the fallopian tube with all these hands like this, grabs it, and it goes all through here. And you have sex here. If you do not have sex, comes all here. When it reaches here, that's what you call, this is ready. The endometrium, the inside lining of the uterus are ready. It's getting ready. It's a lot of hormones that is getting this ready. And the hormones reach to a peak. And if you do not get pregnant, it sheds. And as it sheds, it comes down to your vagina. One egg at a time ovulates. When the right ovulates this month, the left will ovulate the next time. Sometimes it's rare that both ovaries ovulate at the same time, and you may get twins. Both of them must be fertilized. But paternal twin that look alike comes from one egg that splits in two.
Right.
So this is the crux of the matter. This is what happened. Your uterus, your fallopian tube, your ovaries, your cervix, and your vagina. Those are the organs that are involved in menstruation.
Okay, so just before we go further, we'll take a quick break. That's a lot of information already. So we'll take a quick break and we are going to be right back. When we do, we would look at things like where you actually are going to put your tampon and, all of those things.
Yes.
And of course, we will have to look at conception and so forth. So let's take that quick break and we'll be right back.
Yeah.
You are my strength.
Listen, let us listen. The Grenada journey has begun. Oh, we come now together as one.
We are committed Catholics. Listen to us.
Youth like us must be given a hearing.
I am a farmer and I have a story to tell.
I'm a farmer and I too would like to share my story.
Even though we walk over there Sunday to Sunday, we too have a story to tell.
I am a Catholic sometimes and I have things to say. I need someone to listen. I have a lot to say on behalf of single parents.
The Catholic Diocese of St. George's in Grenada has begun the synod process. Pope Francis has involved the universal church. Your voice is important. Come, share your story, your experience, and your expectations of church.
Going through a storm, but I won't go down. I hear your voice carried in the rhythm of the wind to call me out.
You are my strength.
Welcome back, and thank you very much for staying with us. We are in your face with a lot of information today. Information that I'm hoping that even while you're looking, you're not saying, hey, why are people talking about that on TV? Well, we have to talk about it on TV because that's where you're looking. That's where you're interacting with us, and we really want to be able to, you know, to give the kind of information that can bring a lot of clarity. Anne, who is with me today, always says knowledge is power. It is one thing I've learned from her since the first program that we've ever had together. Knowledge is power. And for if you are just joining us, we are looking at menstruation today. So just before the break, we were looking at how exactly menstruation takes place. And I have my trusty little chart here that we are working along with. So, and we're going back in.
Yes.
If someone is having their period and they're using tampons,
yes,
where will that be inserted? I take it because because of course the water is coming out here.
Yes.
They
insert
the water
it into that hole,
right?
Into the vaginal hole,
right?
Here, right here.
Mm-hmm.
They insert the tampon,
right?
It stays up,
which is actually this right
yes,
here.
Yes, mm-hmm. Yes, just the vagina here,
right? Okay,
that's
so then most likely it will be staying just there. Just
yes,
there.
Yes. It's made with a material that expands.
Correct.
As it gets wet, it expands.
Exactly. And then, of course, you have the string that you can easily pull out and then you're good to go.
Yes.
So, and of course, for those of you who may be thinking, you see me, this tampon thing, I never tried that, I'm not going to try it because of what you've heard, I would say here what? Just ensure that you follow the instructions on the box.
You take it out.
Wash your hands, make sure, because we know that there are, like with everything else, there are going to be, can be possibly effects, you know, right. But you can have bacteria on your sanitary napkin as well if you are not very hygienic, so it doesn't really matter.
I think this tampon is more hygienic because it comes wrapped, while you know,
there are some pads that are just
not wrapped,
there,
in a box.
True.
Yes.
So please don't, and this is not us, you know, advocating tampon. This is not what the point is, but it is to say, especially for those of you who may be engaged in, like you go to the gym, you have a lot of activity that you just, a sanitary napkin may just not be able to accommodate you properly for what you have to do.
A lot of them fall out when I was young. You pass it and nobody turn around and pick it up.
I know, right? Yeah. I've heard of those. I've never seen it.
I've seen it.
Goodness.
Well, they never turn around and say it's theirs.
Well, I don't think it. And you think anybody would say it's theirs?
I know. Never picked it up and keep going.
I'm thinking exactly. I'm thinking that is going to stay right there.
Of course.
So your tampon certainly is not going to do that to you.
That's why we're ashamed of having our periods now. You at work, you don't say you're having a period. Now children just say anything. It comes natural. That comes natural for a 5-year-old, 10-year-old.
Once you know about it, you flow with it. But one of the things too, though, I know it might be a little funny, but I remember when people don't teach people how to do things. I remember having a friend and she put on the sanitary napkin, but didn't realize that, of course, the sticky part needed to be stuck on the crotch of the.
That's right.
So needless to say,
that's right. That's why it's important for mothers to start teaching the children 6-7 years old, because I know 7-8-year-old
who have had their period. Yeah, I know of 9-year-olds, but no, 7 and 8. Wow.
I had a niece, 8-year-old. So I was 10 and a half. So mothers should teach their children.
Yeah.
And when they're becoming that age, first of all, before we go into menstrual period, we have to know what a mother should look for. We call it puberty. What changes, physical changes, we should have gone into that before this. What physical changes occur in your child to know that the child soon, rather than later. You see the child start having pimples on her face.
Right.
You see the child start developing pubic hair. You see the child under the arm. You see her perspiration start to have some type of odor. You know, these are all the signs that tells your mother, tells the child parent, soon my daughter is going to, she start having little birds, little breasts. So all that you have to look for, because now she's turned into puberty.
Right, she's going through puberty. Quick question about the breast. What's up with that little seed inside in that? For real, what? Because it's painful for some children.
That's tissue, muscles.
It's just muscles.
It's just
really.
muscles. That little seed is hard muscle.
Man, when you growing up and somebody hit you, especially if you like to play rounders, man, or somebody bounce you, oh, that thing could send you crazy.
Hard tissue that is there.
Really?
Fibrous tissue. And you see, as you grow up, somebody will say, the doctor will say, you have a lot of fibrosis, a lot of fibrous tissue. And we cannot really tell sometimes the fibrous tissue prevent the diagnosis of cancer of the breast because it's so dense.
Really?
That, you know, it's so dense that you cannot
So that
really,
starts first?
Yes.
And then, of course, when you just start to grow.
As you go. Okay?
Oh,
and the average girl, I may say, when that happened, about 2 years after you see the little breast coming, the little here and there, the little here there, they start shaming. They don't want to be seen naked now because, you got to look forward between a year and a half, 2 years, then they start having the period. And the average person, they said, have the period between 10 and 12, but I've seen 8 and heard of 8.
Right. And then, of course, you have the cases where there are some people who all at 16 haven't had it. So then what happens then exactly?
They have to go to the doctor. Hormones, the hormonal changes. The doctor may have to put them on hormones.
Really?
Because they
to
are
activate it?
To activate it. And sometimes, you know, most people born without a uterus.
No, I didn't know that.
Oh, yes. Some people born with 2 or 3 uterus. Some people.
Well, I know for sure of someone who has 2.
Yes, some people don't born with any. Some people don't born with any vaginal opening.
Okay then.
So
what happens? Okay, hold on. So you can. All right, let's back up again. Whew. All right. So if you are born with no vaginal opening, it means that this part here is just closed all the way. Closed. But you might have a urethra still.
Yeah, you have a urethra, and sometimes you have just a little opening if you have uterus. A little there, a little hole here instead of that large hole. A little hole where the blood may come through. I know.
So what they would do surgery or something to open it back?
She didn't have surgery, so she's still closed. I can't give you a joke about that.
No, but then so would that person be able to have sexual intercourse and so?
Because there's no hole to go in.
But you say blood coming out.
A little tiny hole. What could go in there?
Well, I mean, okay.
A little tiny hole. You know, a little tiny hole like this. So that all this is closed, all this is closed up, all this is closed up, but a little tiny hole just for the menstrual fluid to come out. You get me?
Yes.
Instead of having a hole like this, right? I'm not a good, okay? All this is closed up.
That's all right.
Yeah, all this is closed up. All this is closed up here, right? And
so
you just have, right. So you just have so what the doctor may do, he may just put a slit, go in there and slit this down. So it opens.
Okay then. Whew, that just did something to my blood flow. Made me feel very uncomfortable, but okay. Whew, all right. And then so for the person with the no uterus issue, if someone is born like that, well, that's just it.
No period. No period.
Oh. So they well, because of course, because they but then if they have no uterus, which is this here, is it that they may have had ovaries?
Yeah, but where will it go if they don't have no uterus?
But that's what I'm saying. But can they have the ovary and still no uterus because they have a vagina, but no. So how do you end up with? Okay,
yeah. This is what you call defect, butt defect.
Yeah, butt defect. Yeah. So it's
you
like,
could born with anything. You could just maybe have one ovary, one tube. Okay.
Yeah, yeah.
No ovaries, no tube, just the uterus.
Oh,
you could born with any part missing.
Ooh. Oh, Jesus, I thank you very much, Father, for what you have given to me. Sometimes we take it for granted that we have
we take a lot of things for granted.
Yeah, for real.
A lot of things.
You just don't think of that. Yeah.
Some children born without any penis.
Okay, none at all.
None at all. Just maybe the two scrotum, just the scrotum, but no penis. Some children born, they have no scrotum. The testicles is not descended. Undescended testicles.
So where is it?
It's up in the abdomen. So the doctor have to go in and get it out.
And then put it where? Okay.
Take it out and put it in the scrotum.
Also the skin for the scrotum, it is there, but it just don't have any nuts in it.
It's in the abdomen. So the doctor will go in and pull it out and pull it down in the scrotum.
Oh Lord.
Sometimes they're born with none.
And then what do you do? But then what? Okay, so if you're born with, okay, wait. You're going a little fast. I'm slow today. Listen, maybe viewers and listeners maybe you are slow like I am for today. You know, so today let's go slower. Let's go back to the person with no penis at all. If you have no penis, I'm not even thinking about a sex bath. I'm just thinking of at least being able to function and urinate. What happens there? Because there's
hole, no penis there, but you may have a little hole coming out from the skin.
Oh, and the penis is
long like this.
Yeah, of course.
Right. So it's just maybe this and a little hole here, and it's just the pee coming out.
So would they make a penis for the person, or?
I've never heard that they make a penis, but
with all the technology that we have these days.
But I've never researched it. It's possible, but I've never researched it.
Okay, fair enough.
Okay.
All right, let's go on. Oh, my goodness. All right.
You was asking about pregnancy in the tube.
Yes, I did say that we would talk about it. Right. So, for menstruation, you mentioned that the egg is going to leave the ovary, of course, and then the fallopian tube. And then, of course, if the person had intercourse, then they get pregnant.
And they may not.
It should, or they may not. If they don't get pregnant, obviously that's when we have the period.
Yes.
If they do get pregnant, then of course I take it that the egg is going to rest in the tissue and so forth.
In the endometrium, in the inside of here.
Right.
You have sex here, okay, and the sperm is going up, the sperm is going up, the sperm is going up, and the egg is coming down.
Right.
So it can meet the sperm. The egg can meet the sperm anywhere. Sometimes the sperm so very fast, swimming up, swimming up, they're happy, and then they meet the egg right here. Okay? If they meet the egg right here, and it start growing, and it start dividing, it may get stuck here. It may not move down to be embedded in the uterus. So we call that ectopic.
Right. Because I know that there are persons who obviously, you know, would have gone through that. But in a case like this, though, two questions I have about it. Is it that it can be removed, like guided and placed in the right place? Or is it that it will just, once it's there, that's it?
That's it. I had ectopic pregnancy. In my left side, left tube, the egg got stuck right there. And I had what you call a left ovarectomy. Ectomy means to cut away. So they had to cut away the whole tube and take it out because it's nothing. It was macerated. The fetus was macerated. The egg was macerated. That means squashed up all, you know. So it's right here. So they had to take out this whole thing. So I myself, the ovaries are there, but I have no tube.
To that one ovary?
Yeah, to that one ovary.
Wow.
Yes. Okay. But I was still able to have my period because of this ovary. And I could have still get pregnant because I had one ovary. I had both ovary, but this one will be useless really because the filament, there is no filament there. That is called the filament or the hands, the fingers, to hairy like, to it's like hair on your head and a lot, you know, filament. Take it to bring down into the uterus.
Because there's nothing there. Right.
There is nothing there.
But then, so in a case like this, if, like in your case, there is no fallopian tube, but the eggs are still in the ovary,
but
so they just cannot be released.
They cannot be released. Because if they release it, it's not going anywhere.
It's not going anywhere. Okay, all right.
Okay, okay. So you still have this one, so you could still get pregnant.
Do whatever. Okay.
Yes.
So, okay, quick question. When we're talking, so sexual intercourse, obviously, it's taking place here, penis is here. What ejaculation the sperm will only obviously go up. It's not like if you could have sperm all here.
No. Well,
here I'm asking, okay, go ahead.
You remember, sperm can remain in the vagina and the cervix for over 5 days. You can only get pregnant once because your egg, after 24 hours, disintegrates. After 24 hours, your sperm, your uterus, the eggs start falling apart. Okay, but the sperm can remain in your vagina up here for 5 days. It can stay alive.
I think you need to go on every radio station and tell people that, because you see that I think some people are in serious trouble with that lack of understanding, because you would figure you had sex today and not only that, I had sex with whoever this is today, and I never had, or maybe it's a one-off occurrence. I never had sex with anybody again, and sadly, but we know it happens, it could very well be somebody that you didn't have no right having sex with. So you figure that was a one-off operation, I good to go. But the sperm, you're telling me,
remains 5 days, could live for 5 days.
That is not good news.
While the egg could live for only 24 hours, so you could only get pregnant during your ovulation time.
Yes, but then what if the person, okay, so the sperm went there today, maybe there wasn't an, so what if an egg was not released, the sperm is there, so you're telling me an egg could have to release and then it need the sperm that was waiting
because
there?
you could have 4 days before you ovulate, and the sperm there, so when you ovulate,
that is not
it catch it. That's why also
you're not helping.
That's why also
I think you're making it difficult for people.
Well, I had sex 5 days ago, and when the child born, that's not mine because they count the time and they said 5 days, but not realizing
that the sperm could be
or she can go now have sex 3-4 days, 5 days, and on the 5th day she might not have sex with somebody else. Okay, so that child could be that first guy child,
really,
and not the second guy child.
You're kidding? Okay, this is a lot. All right, Gloria, you are giving us really well today. Let's. So we just go to the menstrual cycle and then we'll wrap up. Yeah.
You see, as we go already, that the egg travels. The egg travels to the upper part. You see the egg here. And as we say, it travels down, okay? And when it travels down, it gets embedded in the uterus here, okay?
Yeah.
It gets embedded in the uterus here. But this picture is telling you how the uterus bleeds, you see? And
so
how the blood
that's why you have this
out.
bright red spot. So this is actually the blood, right?
That's right. And the implantation, and is in here, the implantation that you start getting the umbilical cord and everything is being made.
So all of this is going to be transformed to accommodate this baby.
Going down. But if you don't get pregnant, all this is the accommodation, because you have the endometrium, which prepares itself and gets very thick for the implantation of the egg. So once the egg is implanted, you start having your umbilical cord, which is the cord that feeds the baby.
So that is one of the things that will start to grow first when somebody gets pregnant.
Yes,
interesting.
Yes.
Okay.
The endometrium. Okay, right here.
Right.
And now something could happen. The egg could be implanted here. The egg could be implanted here. The egg could be planted here. The egg, it's safer if it's implanted up here, because what happens if the egg is implanted somewhere here and the afterbirth began to grow, then you have what you get, placenta previa. The placenta is before the baby. The baby should be
before the
that's right. So what you get, placenta previa, and it's very dangerous because then the placenta will discharge before the baby come and the baby can die.
Oh my. Okay. All right. Well, I'm telling you, thank you. You get me all a little bit flustered. Almost. It's just so much. Listeners and viewers, I know for sure we've given you a whole mouthful today. The good thing is that you can check out our Facebook page. For those of you who not, you're not viewing on Facebook, but you can do that. So at least you can take your time and listen to this all over again. And what you can also do, I'm encouraging you to do, is to send us some questions and so forth. You could do that on the Facebook, page as well. I don't even know how to say whew. All I can say is whew is a lot. And because, you know about your period. Generally, just know about your period. But to be able to go in like that,
what to your body.
What's really going on in there.
And your period don't only come like that. You have hormones. The signal comes from your brains,
to do
in your pituitary glands. It doesn't come from your belly. It comes from your brains to tell the period when to come, when not to come. And
all right, so Anne,
the hour finished?
Yes, it is.
The hour is ready?
Yes, it is. So here, what we are going to do?
Not quarter.
I know that. So because of that, next month, God's will. Of course, I know that you are going to come again so that we can continue. Thank you so much again for just being with us. It was and always is a pleasure to have you. Thank you so much for coming. You can just end with whatever you want to tell the listeners and viewers, and then we can tie up today.
I'm very happy to know that we have listeners. And it's not an easy thing, because I did not know anything about, I was a nurse. And before I went through all this, I didn't know what was happening to my body. I really didn't know. But I took my time and I studied it apart from getting it in the classroom. Because, I studied in England. Sometimes they speak, you don't even understand that you're in that class. So therefore, you had to go and study yourself.
For yourself, yeah.
And I'm very happy that even after I become an RN, I really didn't even really understand how my body works. So therefore, I went and I Google. In my days, it wasn't Google, but we had textbooks that you can go and check out. Yeah. And I hope young mothers is able to look at this and inform the children, teach the children the changes that are causing the body and what to expect. And prepare your child for menstruation. Don't be afraid. Don't say you're having your period, don't have voice. Tell them if you have sex, what happens. Show them diagrams, what will happen. You're not getting them afraid, but you want to keep them safe, because so much ST diseases, syphilis, diseases that cannot be cured or treated. So you have to educate yourself. But please, don't be afraid to be a friend to your daughter. Be a friend to your daughter so she can come to you with all her problems.
All right. Thank you very much. Sound advice. Well, thank you again for joining us. We will chat. We would see you. I would see you rather next Friday, God's will. Have a really safe rest of your day. Enjoy the rest of your weekend, because the weekend has officially begun. God bless you and keep you. All right. See you then.
And it's really a pleasure. Really
Definitely.
A pleasure.
Same here. Thank you again for coming.
You are my strength like no